Hey everybody, welcome back to No More, No Less. I'm your host, Michael Cecchin, and today in the virtual studio, I'm joined by Shay Hipperson. Shay has a master's of psychology and is the principal psychologist and clinical psychedelic-assisted therapist at the Conscious Mind Centre in Queensland, Australia. Her work focuses on complex trauma, PTSD, substance abuse, and chronic illness. Shay approaches her work from her own journeys through recovery from chronic pain and PTSD. And just to set the stage, outside of approved clinical use, psychedelic assisted therapy remains strictly prohibited and illegal in Australia as it does in most countries. However, in Australia, you can access this new type of care if you have a diagnosis of treatment resistant depression or PTSD. Today, we'll explore what integration really means, how the process of psychedelic assisted therapy is evolving and what it looks like right now, how body, mind, spirit therapy works in practice, and we'll explore psychedelic assisted approaches and why they're both promising and potentially perilous. So, Shay, I'm so excited. Let's dive straight in. Welcome to the show.
Thank you so much for having me, Michael, and I look forward to this conversation.
So, I guess we can start, at the beginning. How did you go from clinical psychologist, talk therapist, if you will, into this new world that is very quickly evolving all over the world?
Yeah, and I guess my pathway is not really linear from what most people would expect psychology training. I actually came across a MAPS study. I believe it was a phase 2 study back in 2016. And at the time, I was in my undergrad psychology studies. It was a sheer accident, maybe luck, maybe fate, I'm not sure. But from that moment on, it really changed the trajectory of where I was going with my clinical practice. I always knew I wanted to be a clinical psychologist when I started university. We can come back to that because I never intended to go to uni. But in terms of the psychedelic therapy and how helpful it has been shown in mental health and treating hard to treat conditions, my passion's been there for years and years. And I'm just so blessed to be in Australia at the time where we led the world in rescheduling these medicines for clinical use.